There are many muscles that make up cervical spine anatomy, but for the purposes of the certification course, we're only going to be discussing three of the main neck muscles that are stretched using the movement method. The sternocleidomastoid, or SCM, is a large, two-headed muscle of the neck. Its clavicular head originates from the medial third of the clavicle, while its sternal head arises from the sternum or breastbone. The heads come together and ascend diagonally to insert onto the mastoid process of the temporal bone on the back of the jaw. The trapezius is a large, flat, triangular muscle that forms a diamond shape. The muscle extends over the posterior or back of the neck and the superior part of the thorax, which will be discussed further in the thoracic spine anatomy lesson. For the cervical spine anatomy, we're only going to cover the upper trapezius. The trap is divided into three parts: the descending or upper, the transverse or middle, and the ascending or lower. The upper trapezius is composed of the superior fibers that originate from the medial third of the superior nuchal line and the external occipital protuberance of the occipital bone at the base of the skull. These fibers pass downward to insert onto the border of the lateral third of the clavicle on the upper chest. So you can see the trapezius covers a large area even in just the upper back. The splenius capitis originates from the spinous processes of the lower cervical and upper thoracic vertebrae, C7 through T3, and inserts just below the lateral superior nuchal line of the occipital bone on the skull and the mastoid process of the temporal bone on the jaw. The cervical spine's range of motion is approximately 80 to 90 degrees of flexion, or looking downward, 70 degrees of extension, or looking upward, 20 to 45 degrees of lateral flexion, which is touching your ear to your shoulder, and up to 90 degrees of rotation on both sides, which is looking from side to side. The functions of the sternocleidomastoid muscle are lateral flexion of the neck on the same side and lateral rotation of the head to the opposite side. Bilateral contraction, or both sides contracting, of the SCM produce flexion of the neck, drawing the head toward the chest. The main function of the trapezius is to produce lateral flexion and rotation of the head and extension of the head when they act together. In addition, the trapezius muscle stabilizes and produces movements of the scapula, such as elevation, depression, which is like raising and lowering or shrugging your shoulders, and retraction and rotation of the scapula. The function of the splenius capitis muscle is to extend the head when contracted bilaterally on both sides, as well as unilateral or one-sided contraction, which produces lateral or side flexion and rotation of the head to that same side. So if the left side contracts, your head turns to the left. There are many causes for neck pain. A few common examples are sleeping with the neck at an awkward position, falling or sudden impact that pushes the head to the side, such as a sports injury, turning the head side to side repeatedly during an activity, such as swimming, slouching with poor posture while viewing the computer monitor, or looking downward at a mobile phone for prolonged periods. This is sometimes referred to as text neck. Experiencing excessive stress or anxiety, which can lead to tension in the neck. Holding the neck in an abnormal position for a long period, such as cradling a phone between the neck and shoulder. A dysfunctional movement pattern of the neck, forward head posture, or forward head alignment, is a compensation pattern that is common in today's world due to the combination of high levels of physical inactivity and high usage rates of electronic devices. People are constantly looking down at a phone or computer screen. In this compensation pattern, the cervical or neck and the suboccipital head muscles become overactive and tight due to the demand to position the head to optimally view an electronic device, screen, or point of interest. The muscles of the back, hips, and legs are designed to support the positioning of the head. However, these muscles become weakened in comparison to the head and neck muscles due to the imbalance between physical activity, movement, and the mental communication activity stimulation of the mind and head sensory organs. The end result is head and neck muscles compensating for the lack of support from the rest of the body, leading to tightened muscles and transformed head and neck alignment. Again, we see how treating the whole body is important, as muscles as far away as the legs can impact the optimal movement in the neck and vice versa. Here are two neck stretches. One is a self-stretch, and the second is a passive stretch that is done for you. To perform the self-stretch, find a comfortable seated position with feet flat on the floor. Slowly tilt your head to one side as you gently apply pressure with your hand to the side of your skull to increase the intensity of the stretch. The second stretch is a gentle, passive stretch done by a professional.